Hello everyone, this is Anjali. So today we are going to talk about lateral pelvic tilt. So few of you might have noticed your one hip a little higher than the other. Especially when you are standing, you might feel your tends to give more weight to one side of your leg. So this is what we said a lateral pelvic tilt or uneven hips. So in this video, we are going to talk about the common causes of it, the typical signs and symptoms, and how to analyze by yourself and how to overcome this issue. Over time, these small problems can compound effect and that can reach up to your shoulders and your neck spine. This could be a reason few of you might have developed unevenness in your shoulders as well.
Causes of lateral pelvic tilt or uneven hips.
Structural leg length discrepancy. So it is an anatomical leg length discrepancy where your one leg is shorter than the other. So this only can be corrected with a corrective insole. Especially if the leg length differences become more than 2 centimeters, you will advise to get the corrective insoles to correct the leg length. Functional leg length differences. This is where a physiotherapy can really help you. The major muscle group which can contribute to the lateral pelvic tilt are the lower back and the hip muscle. A lateral pelvic tilt become a result of an imbalance of a QL, the quadratus lumborum, a lower back muscle, the hip abductors, the outer hip muscle, the hip adductors, the inner thigh muscle.
One of the reasons people developing lateral pelvic tilt is the improper sitting posture. People sitting giving more weight to one side of the hip, which eventually making one side of a muscle weaker, which leads to unevenness in the hip.
Common signs and symptoms of lateral pelvic tilt. So you might have a generalized lower back pain, a hip pain, a buttock pain. Especially you might feel the pain when you are standing, walking or sitting. Very rarely people complain pain in lying down. The pain becomes more obvious when you wake up. But when you have a huge lateral pelvic tilt, you might develop pain along the leg, kind of a sciatic pain. Sometimes you develop a scoliosis and unevenness in the shoulders as well.
How to check lateral pelvic tilt or uneven hips?
Here I am going to show you a few tests that you can do it at home to self-analyze your hip levels. So we'll go one by one now.
Test 1. Stand in front of a mirror and check the level of your hips. Your right and the left should be in the same level. Test 2. Single leg squat. Stand on one leg and do a single leg squat. When you are doing the single leg squat, if your hips are in the same level, the test is negative. But when you are doing the single leg squat, if you have a hip drop, the test is positive. It indicates the leg you are standing on, the hip gluteal muscles are weak. How to fix lateral pelvic tilt?
So here I am going to demonstrate a few exercises to strengthen the weak hip muscle at the meantime to mobilize the tight hip muscle to level up the hips.
Right QL stretch. To do a right QL stretch, keep your left leg forward, right leg back. Lean towards your left side to open up the right lower back and the hips. Feel the stretch and hold it for 20 seconds and repeat it 2 to 3 times. Foam rolling to the left adductors. To do that, lie down on your right hand side. Keep the foam roller between your legs and the floor. Feel the pressure on the left inner thigh muscles. By using your body weight, give the compression and move your body forward, backward to release the left inner thigh muscles. Foam rolling to the left outer hip muscle. Lie down on the top of the foam roller. Give your body weight to the foam roller. Slowly move up and down to release the tension on the left outer hip muscles. right side leg raise. To do that, lie down on your left side, keep your left knee bent and the right knee straight. Raise up the right straight knee from the hips by using the right gluteal muscles. Hip drop. Hip drop is to strengthen the gluteal muscle in a standing position. To do that, stand on the right leg, keep your right knee straight and long. Let your left leg to reach down the ground. Slowly use your right hip muscles to lift up the left leg. This will strengthen the right gluteal and the left QL, the lower back muscles. Squat with the resistant bands. Here you will put the band resistant around the right knee. In a way the band can pull the right knee towards the left side. And try to do the normal squat. Try to balance your right knee and the right hip in a straight line. This will challenge the right gluteal muscle and strengthen it.